Oh, hi. My name's Rana. I'm from New Zealand, but I work as a certified aesthetic nurse specialist in Chicago. And we've been very fortunate the last couple of days to have expert training with Dr. Tom van Eyck. And the reason why we've come all the way to the Netherlands is we haven't been able to get that type of training in the US. So we've learned so much in the last couple of days in terms of the right treatment for the right patient, placement of product, and what we can do with such a small amount of product to give the best result.
Release it, get out. You don't want any material superficial. You don't want any material underneath the skin, in between the muscle.
And we're just so excited to be here, and it's been great, hasn't it?
It has. It's been wonderful. So my name is Amy Martin. I'm also a certified aesthetic nurse specialist practicing in Chicago. Something that Rana and I have always tried to push towards is always doing more safety techniques with our patients.
As well as treating my own patients, I'm also a trainer, and it's really important to keep advancing yourself and work with some of the best experts in the field, and that's why I'm here, and I've got so much out of the last couple of days, and I just don't know where to start. I'm so excited. I've learned so much, so many great things that I can do for our patients and give safe and wonderful results whilst looking natural. I can't thank Dr. Van Eyck enough. This has been a wonderful, wonderful experience, and I'm coming back next year.
Learning the ferning pattern, lip tinting technique, palma, all of those things force me to reevaluate what the weaknesses are within each of my patients. In the US, right now the trend is to look at volume, really understanding that the end point is not necessarily volume, but where is the weaknesses in the patient's skin strength. So therefore, addressing that first and using less product to create a softer, more natural look. That's what I'll really be focusing on with my patients when I get back to Chicago. And I had actually heard of Dr. Van Eyck from another colleague that I was taking a training course from, and she had just randomly thrown out his name as a technique that she had looked at herself, and ultimately that's what brought me to the Netherlands.
Yeah, and I'd also heard about him in Australia. I met with some nurse injectors and said, if you want to learn from the best, you have to come here. So here we are.
There we go. And we don't want to leave.
You don't have to inject much, just at the right spot.
Oh, that's great. Look at that.
Okay, Ron.
Oh yeah, yeah. Wow.
Good.
So I would recommend this to anyone that's looking to further advance themselves in the best techniques, you know, and use product wisely. And use product, when I say wisely, using it safely, giving the patient the best outcomes. And any fool can inject, 2, 3, 4, 5 syringes. But
in one sitting.
Yeah, but what we've learnt today is really how to inject it in the right place to give the best natural result. And
I think even just the basic understanding, as you will find out when you take a lesson from Dr. Van Eyck, understanding strength versus surplus versus volume, that to me is something that I've never been taught or looked at the patient that way before with trainings in the U.S. So it's been great.
And we're not novice injectors either. I've been injecting for 12 years, and this is new information, and I wish I'd started injecting this way. And today I've been laughing because I've been saying patients have been thanking me all these years for bad work. And now I'm going to give them something that they're going to absolutely love.
It's I can't imagine not knowing this information from day one. So,
Yeah.
But we have.
Yeah, that's great. Thank you. Thank you very much.